Michael Fine today, with the one caveat that the governor will be on at 1 o'clock. You can watch her live on GoLocal with press event, but the numbers are substantially higher of the number of new cases here in Rhode Island. Dr. Fine, what do the numbers tell us?
They're going up. We have 566 new cases and 628 catch-up cases. That's higher by far than we've ever seen before. However, it was on very robust testing yesterday. They tested about 15, almost 16,000 people, which actually may be among the highest days of testing we've ever had. Troubling is that hospital numbers continue to climb and climb pretty rapidly. We got 182. Now that's a one-day jump of about 13. So you want to see it over a couple of days before we make any judgments about it. But when you look backward, we're really seeing a continued slope up. When you look at the days when, or the length of time, we have really essentially doubled our cases. I would expect hospitalizations to basically double from here.
Yeah, listen, I'm looking over at data, historical data. The last day we had where we were under 300 new cases was October 21st on a consistent testing level. And now we're at 566. So, we're functionally seeing a doubling in about little more than 2 weeks. So significant growth in the spread. Also on the 15,000, we don't have the college numbers, but probably 5,000 to 6,000 of that is asymptomatic testing happening at the colleges and universities. So we do always have to keep sort of the apples to oranges in some kind of consistent realm. The other number that is just a heartbreaker is 8 deaths.
Yeah, 8 deaths in one 24-hour period. That is a heartbreaker. My guess is that, that we're going to see an average of 5 deaths a day for the next 8 or 10 or 12 weeks, unfortunately. 8 is a little on the high side. We've had, thankfully a few lower deaths for the last 3 days. Kind of averages out over time, and I think we're going to be at 5 to 6, maybe 5 to 10 over the next couple of weeks, maybe higher, depending on where hospitalizations go.
A question for you is, we're seeing doubling in 2 to 3 weeks of number of new cases. That kind of tracks back to the weather beginning to change. Now we're going to get a week of good weather. Hopefully people are spending a lot of time outside. But when does this start to see exponential growth, where we're starting to see numbers really transform? And, how many weeks are we away without major changes from being at 1,000 new cases on a daily basis?
Yeah, I think that's a little unpredictable. It depends on people's choices. We have a reprieve because of the weather for the next week, which is wonderful. We should have a weekend where people can be outside, not inside. Thank goodness. We will have extra cases because of Halloween that should start hitting right about now. Probably start hitting yesterday. And those we'll see those for the next 10 days or 2 weeks. And then the question becomes, did each of those cases give rise to other cases? I'm guessing we're going to see more rapid growth, probably 10 days, 5 to 10 days after the weather turns bad again, and people are pushed inside. So
okay.
I think 3 weeks, something like that.
So cities and towns, those numbers are out. The goal of the state is to have the number of new cases on a weekly basis be under 100 per 100,000. You've argued that number should be substantially lower. It should be 20 per 100,000 in a 7-day period, but the state's number is 100. We have Central Falls at 748, Pawtucket at 346, Providence is around that neighborhood.
Providence, North Providence, Johnston, and Cranston, all above 300 cases per 100,000 per week. about 5 other places, Foster, Cumberland, Lincoln, and East Greenwich, being in the over 200 cases per 100 per week. Many of those communities, Central Falls, Johnston, Cranston, Foster, Lincoln, have doubled inside of about 2.5, 3 weeks, with Portsmouth, Middletown, Situate, Barrington, and East Providence also doubling in the last 2 weeks. Those are the places to watch. The good news is that Lincoln actually came down some from 259 to 208. But remember, because of this multiplication effect, when you're using a denominator of 100,000, it probably isn't as big a deal as it feels like. That really represents a difference of probably 5 to 10 cases over the course of a week.
But based on the cities and towns you just mentioned that are seeing substantial growth, whether or not it's a little pumped just based on the type of analysis we're using to standardize it, we've always had troubles in the urban corridor, the Providence, Central Falls, Pawtucket, Cranston. Johnston and North Providence have had issues all the way through since March. Now we're seeing it really across the entire state. There's no region in the state that there is not a city or town that is seeing substantial growth and or significantly higher than the 100 cases per 100,000.
Yeah, I mean, I'm looking at Portsmouth and Middletown. Aquidneck Island looks like it's getting ready to blow up. I don't know how common testing is on Aquidneck Island, how easy it is, but that's something I look out for, because we may not be seeing cases in Newport, or I wonder if we're not seeing many cases in Newport, which has some particularly urban areas, because we're not testing much. And I think I worry about the same thing for Woonsocket and for Burrillville, where I would expect to see more cases than we've seen. I wonder how much testing is happening in those places.
Doctor, at 1 o'clock, the governor goes live. We've got a number of issues. She's dealing with a number of issues, across a number of complexities. What does she need to do to, if nothing else, just slow the pace of growth?
Well, I'll go back to some of the things I've said before. I think this is about out-of-home isolation. I think it's about enforcement right now. I think it has reached the stage where contact tracing is not going to be able to keep up with it, or not be able to keep up with it effectively. So I think we need to start thinking about how we pull people out of houses so they don't spread it in their own houses. And then I'd like to see us doing more enforcement around masking, and even if it's sort of general promotive enforcement, where we get police involved helping people to stay masked. That's a critical piece as far as we can tell. And then enforcement of isolation and quarantine, and real clarity about the need to follow these quarantine and isolation rules, so there are no exceptions.
Yeah, listen, I think leveraging the police, sadly, is a difficult strategy. Providence has more than 10 police officers out right now. They've had more than 50 police officers infected since the beginning. And, we're beyond anecdotal. You can't find a Providence police officer wearing a mask. They weren't wearing masks during the protest. They're not wearing masks on details. You can look and look and look, and you just won't see it. It is, I don't know if it's a cultural issue. I don't know if it's lack of direction from leadership at the Providence Police Force, but that's an ongoing problem over in that department. And this is an undermanned, underwomaned police department right now. So to have 10 or more police officers out at any given time has a significant impact on their staffing.
Yeah, but I also think we should be testing all public safety folks, fire and police, twice a week. If we can do that for college students, we ought to be able to do it for our police and our fire guys.
Well, government can't do it for students. The schools are doing it. I mean, I think
Right.
you know Brown's going to be at 100,000 tests in less than 2 months, and or about 2 months, and that's about 8% of all the tests we've done since testing began in March. So maybe we should outsource it to Brown because they seem to be most efficient at having a significant ongoing testing structure and getting compliance for it. So maybe we have to admit all Rhode Island citizens into Brown University to be able to improve upon that. Where are we? We know what the traditional tools were in the spring. Close down this, shut down that, lock down this. The governor has talked about strategic shutdown, strategic implementation at 566 new cases and a growth rate that is now bordering on exploding. I get it that we're not at exploding. Can you strategically make changes to how business and people are interacting in order to achieve any real impact on the spread of the virus?
Well, unfortunately, it hasn't worked well so far. And that suggests that the likelihood of success is small. To try to close the restaurants or bars at 9 o'clock at this point seems like, it's like using an eyedropper to put out a raging fire. So I think those little strategic changes make us feel good or make us feel like somebody's doing something, but I don't see it changing the progress or outcome. We're going to have to be really rigorous. And I've said before, we need thousands of healthcare workers. Instead of spending money on some of the stuff we're spending on, let's take some of the people who are getting unemployment checks and get them to work doing this. Pay them 15 or 20 bucks an hour and deploy them widely. If the police can't help with masking, let's get another task force to do that. And, sort of get money into the hands of people in communities who need this money so badly.
Dr. Fine, 15 minutes away, Governor Raimondo, you get the last word. What's the one thing she's got to do and do it quick?
Oh, I think it is kind of getting us to what I've called before, not exactly a state of siege, but help us understand how significant this is. Now, man, how it will disrupt the economy, if it to the extent that it hasn't already. I think it's about having us change our posture so that our posture is focused on stopping this thing instead of this posture that seems like it's go along and get along.
Dr. Michael Fine, thanks so much. More to come. Stay tuned. 1 o'clock. You can watch it here live on GoLocal. Gina Raimondo addressing this significant outbreak here in Rhode Island on this significant second wave, significantly higher number of new cases in this second wave on a daily basis and on a growth pattern than we had in the spring, and hospitalizations continue to grow. Stay tuned, everybody. Can't say it enough. Save a job, save a business, wear your mask.
Thanks, Josh.